It's time. Now here's your host, Dr. Cheryl Shire.
Welcome to Your Prescription for Health and Wealth. I'm Dr. Cheryl, and we have our guest today, Hunter Moore, is the CEO of the Redwoods, the Community for Seniors. This is the second time, except that we're not in the studio this time around due to COVID-19. But we're here. We'll do the absolute best that we can. Hunter is the CEO of the Redwoods. He is multifaceted and has 30 years experience in working with facilities, etc. Like I said, multifaceted, and a deep interest in innovative and high quality, affordable senior housing and services. He is delighted to bring his entrepreneurial spirit and approach to inspiring an innovative and affordable retirement community to the Redwoods and to seniors, and to support the life of seniors in the greater Marin community area. Thank you for joining, Hunter. Thank you.
Dr. Cheryl, thank you very much for having me again today. It's a pleasure. It's an exciting time. It's a confusing time. It's been a scary time, a scary year for a lot of people, but we've actually got a good success story here and working with our surrounding community. And I'm looking forward to telling you and others about it and things that they can do to stay safe as we're all waiting for these vaccines, which fortunately some of us here are going to be getting as soon as tomorrow.
Well, you know, I know that the seniors and the elders have been hit the hardest with this virus that, you know, and the studies that I have done and that I have consulted with experts is that, you know, the strains that are in the COVID actually bring out, if there is an underlining condition, it brings it out, especially the respiratory stuff. I mean, you know, and so that I feel, you know, I have my surrogate mom is up in Washington, Bellevue, and she lives in a community, very nice community, and no one, it's the same as your story, except that some of the restaurant staff have had some issues and can't work there or whatever they're, you know, handling it. But, you know, kudos to keeping it all clean, and you haven't lost anybody in your community. You know, that's important.
Yeah. Well, thank you very much. And not only have we not lost anybody, none of the residents have had COVID at all. Now, some team members have had, and that's pretty typical of what we're seeing around the country, and yes, why now the plan is to vaccinate the workers in the hospital and the workers in nursing care, because the residents aren't going out and getting in contact with people and getting infected. And it is true, 84% of the people in Marin who have passed away are those within a retirement community.
Yes.
But they get it because the team lives with families, goes shopping, is out in the community, and even when we're careful and we're wearing our masks like everybody hopefully is doing and trying to be socially distant, their children get it. They bump into somebody in a situation where, you know, all of us have forgotten at some point to be fully protective and wear a mask or keep the social distance, and then they bring that into the communities. And that's really how it spreads. And it spreads pretty quickly and as you mentioned, in a scary way within communities. So that's why the team members are going to be the first to be vaccinated so that they won't bring it in. That they stop that front line of where the most vulnerable people are getting it and the most deaths are occurring by stopping the team members from bringing it in to the residents themselves. And it's an excellent and well thought out plan. It takes a little while to think about, to understand why they would do the people instead of the staff, instead of the residents, but it actually is based on the science.
Yeah, well, that's important to look at. And, I've been looking at the big picture of this, and I'm actually horrified on some levels.
Over 300,000 people dying. That's pretty horrifying. As a matter of fact, I saw a thing the other day that of the 8 days in the U.S. history where the most U.S. citizens have died, 4 of them have been in the last 2 weeks. The most people. You look at Vietnam, you look at 9/11, you look at the Civil War battles. The 4 of the top 8 days of the most Americans, U.S. citizens dying within the last 2 weeks. It's outstanding, and it's a real problem. People that don't believe this is real or think that these measures aren't important really are missing that big picture you just talked about.
Well, on the other side of the big picture, this has also been planned out, which is hard for people to even hear. That this whole thing, it's called depopulation. And I know that sounds radical, but I have dug so deep on this. If you look at Agenda 21, which actually was signed in 1992 by President Bush, taking over the U.S., basically he was giving up our control, and the UN has control. This is the political side that I don't. No one wants to look at it unless you really dig deep and understand where this is coming from. And when you have people that are sick around you, I would like to see, and this may be some people it'll be controversial. Some it's called being analytical. I would love to see the qualified, what the deaths really are, all these deaths, what it's really caused by, and that.
You mean in that there may be more deaths due to COVID, or
No, what I mean is I want to see that what the actual death is, what has been declared scientifically on the death certificate. What is really caused the death? Because there's heart attacks, there's
Sure.
There's so many other things, whether people have cancer or respiratory, lung issues. I would love to see what that says. Everything is thrown into COVID, but
COVID, much like influenza, if you're compromised, it accentuates the compromise, and so it speeds the death. So you're right. Of the deaths that have occurred in Marin and in California and across the country, there's a variety of things that they point to which actually caused the death, but it was accelerated, is what the belief is,
right,
by having the virus.
Yeah.
And so nobody. There are very few people that are looking forward to dying or speeding their death. And so anything like COVID or the flu or many of the other common things that we get every year that hopefully with vaccinations and preventative measures we can avoid. But it used to be the flu killed more people than almost anything else within nursing.
Right. Well, it's the same concept, actually.
So, right.
Yeah.
So
and to tell you the truth, I have researched and looked at the vaccine. I won't get it. I mean, I've been tested, and I'm a healthy person.
Right.
I have some issues, but nothing serious at all. And I'm more afraid of the vaccine because of the things. I mean, I look at Robert Kennedy's health for children, defense for children, and the stuff that the science that he has dug up about these vaccines, it's scary to me. But I mean, I realize that the elders, they have to believe in their doctors.
Right. And the thing is, without a vaccine, and this is Fauci said this, many people have said this, and this is a major concern, because if not enough people take the vaccine, it will not work. People will continue to die of things related to COVID, not necessarily COVID itself, but the underlying conditions that are accentuated because of it. And that's one of the reasons why here I will be one of the first people. And I think having public figures like all the living ex-presidents do it on camera will help encourage people. And when they see those leaders and other people that aren't nearly as influential like I am, take it and be okay. I think that might help increase the use. And the question is, and a lot of people have put forth the argument, is the cure worse than the disease? And in this case, it certainly appears that way.
Yeah, well,
I mean, it doesn't appear that way. The cure is better than the disease.
Yeah, well, I'm skeptical about it, because what's in the vaccine is scary to me. But
right.
When
and you're among a big group of people in the U.S. and that's why in Marin, with the health department, as they come out to do these vaccinations, they're also sending an information officer who will come and answer people's questions, because there's a lot of misinformation about.
There's
vaccines.
a lot of misinformation on so many levels with what's going on.
Yes. And this is done speedily, and people don't know the long-term effects, and they haven't done it on people under 12. They're just testing on people that are 12 and over now.
Well, and it's not enough. It's what I'm understanding too, is it's not a long enough period to really do the proper analytics on the vaccine, and they're
it is an emergency use. Yes.
It's emergency. Right. It definitely.
Yeah. And they don't know what they don't know. One of the things that they don't know is, if you've had COVID, do you need the vaccine? If you've had COVID, how long will you be able to go without having the vaccine and not get COVID? If you get the vaccine, how long is it good for? There are a whole lot of questions.
Yeah.
We're in a huge spike, unlike almost any other nation, and ours continues to go up while many others have gone down. And the question is how, and the requests, the pleas for wearing masks and keeping distances have gone unheeded over the holidays. And so the number of people dying is just huge. And I agree with you, it's a big problem. But fortunately in Marin, they have some really good people, some really smart people. They're taking a very proactive approach. And the citizens of Marin generally have been better than those in surrounding communities about
we have been totally blessed with
we're lucky to be here.
that we we're one of the fewest counties in California, but beyond,
Right.
So that just shows the precautions, the education, the proactiveness, and et cetera, that we have here, which we're all fortunate.
Absolutely. But, a lot of people will point to the unfortunate fact that we're in the holiday season. Yeah. We're in the middle of Hanukkah right now. We're coming up to Christmas and Kwanzaa. And those are times where families typically get together.
Right.
That is a natural human thing and desire to do.
Well, I usually go up to my family and I'm not going, which,
right, which is really, really hard.
This is a conquer and divide. This is the part of the big picture. Oh my gosh, I'm not going to take too much time talking about it, because this might be new information to you, and that's not the purpose of this recording.
Right. Well, I hope it's not conquer and divide. I hope it's conquer the virus and bring us all back together soon. And soon.
Well, I know, and one thing, and then flu season is starting, and we'll go. I know my doctor is not opening his office until probably after March.
Wow.
Because of the flu season.
Yeah.
So, what Oh my goodness.
And
So,
others are very careful. We're very careful here. I went to
yeah.
a dentist recently who was very careful and had procedures for in and out and different paths. And a lot of us have to make some very difficult decisions like yours about seeing your family
Oh,
over the holidays.
I'm devastated actually because it's my only family, and um,
And
it's
my mother's in Massachusetts, in a nursing home,
uh,
and I haven't been able to see her all year. And
yeah.
it's
Can she do Zoom?
she can, and so I haven't seen her in person, I should say.
Yeah, yeah, yeah.
Um, uh, that's this medium we've all gotten used to.
Yeah,
It's it's better than not seeing somebody,
right.
but it's not the same as being with somebody. And we're social beings. We want to get together and hug
Of
somebody and
course,
kiss our
I
loved ones
know.
and
It's
care for
sad.
them.
It's depressing. I'm sure a lot
Yes.
of people are angry and sad, depressed, um, because of social distancing or not even be able to socialize
Well,
is
and that's one of the
can't.
things, yeah, that's one of the things we've been very sensitive to. A number of retirement communities have really shut down. We've been walking that fine line between safety and engagement. So we limit the number of people coming in. We've
Yeah.
offered these kind of video opportunities to visit. We've had through the window visits, but we've also introduced, and we've gone a little overboard with our light displays this year. As a matter of fact, I could show you with my background one of the things that we're doing this year that's fun.
Oh,
That is
well,
trying
hey,
to trying
there, perfect.
Tried. This is right out
Oh,
back,
yeah, great.
looking out into the Bothine Marsh and Richardson Bay,
Yeah.
um, and that we've had residents even take Christmas pictures out there. We've got lights in the front and the back. We have
Oh, that's
trees
great.
inside.
I mean, it keeps the spirit going.
Yes, going a little bit overboard this year to try and
Hey,
present
who
some
cares?
cheer and joy.
And people walking by will see it too, and just like I put lights up last night. I put up my lights in both the windows that I have looking over the
Right.
bed. And, it's just to say, hey, light, we
Right.
all have to stay in the light.
We're coming to the darkest days of the year. We're 5 days
Yeah,
away from the shortest day, the
yeah,
longest night.
yeah.
But there is a bright light at the end of this tunnel, and we need to find ways to keep people engaged, to
Yep.
find some joy, to find some sharing. We've followed some things from other retirement communities where we don't necessarily want to be the first trying out something new, but if something works, we want to follow it, and we've
Oh, of
done that in
course.
a number of ways. We're also trying to reach out to the community more. We're employing some musicians to come and do outdoor concerts in different parts, and we created a mobile stage even. We're having carolers. We are
Oh,
working
I
with
love it.
local
This is
artists to
great
put up new art inside.
to keep
And
that spirit flowing.
well, we created a YouTube channel, and we've been putting up exercise programs, but also fun programs and we stole from John Krasinski's Some Good News, and we're doing a Redwoods Good News. And so we're sharing
And
good
just to
things that people can
clarify,
be happy about.
yeah, and just to clarify, since you
Sure.
brought this up, is the YouTube channel, and
Mhm.
I'll put this in the credits.
Okay.
The Redwoods, a community of seniors.
Yes.
That's what
Yes.
it is, and
And
it'll be written at the end.
and it's a resource not only for the people here, but for the entire community. If you're at home and you want to do a stretch program or an exercise program, we have them on that channel for free that you can do.
Oh, that's great.
We have other fun things about what's going on here that if you want to smile, you can look at some of these things. Some are a little silly, some are more serious, as well as updates about what's going on here and COVID. We've been talking openly and honestly this entire time about what's happening, what we know, what we don't know, and what we're doing about it. We hope this being not only taking care of the people that work and live here, but the broader community by sharing relevant, timely, accurate information is helpful. As well as some
It's
entertainment.
wonderful that you're doing that. I applaud you because we all need it, but especially seniors, I mean, the aging process, my grandmother used to say, you can't grow old gracefully, but you can sure try.
Well, that's great. And
She
I
was a
imagine
nurse.
she did. And we all want that, right? We're all getting old.
Absolutely, but it takes work.
Yes, it does. But it doesn't mean you can't have some fun too. Even in
Well,
the darkest of times, we're finding ways to have
absolutely.
fun.
Humor, humor, humor. That's
Santa Claus was in our lobby earlier today. So,
Did he bring his reindeer?
no
Oh, no,
reindeer.
wait a minute. The
The
reindeer
reindeer
are
out
back.
back.
I love it. No, that's great. So what are the good things that are coming out of the pandemic for seniors?
You know,
In and out of the
I'm really excited about several things. I think when we look back on this, we will take a breath and say it was terrible, the deaths were terrible, the restrictions were terrible, but a lot of good things came out of it. Um, of this whole time, this administration, how it's handled things, but also what this has forced us to do. It's forced a lot of people to get a lot more comfortable with technology. It's brought up the technological awareness
Yes.
of many people that we work with, and that's a good thing.
Yes.
It's created new ways of communicating, which is a good thing. It's created new ways of working with people and checking on them, which is a good thing. We have also found, like you said, that some people were feeling badly about things and being depressed and staying in their apartments more. And so we've found a way to reach out and provide individual counseling, individual fitness, group counseling and support. So there are a number of really good things in terms of our programs, our dining, our outreach to people on site, our outreach to the greater community that are going to come out of this, that are going to make us and our community better for many years to come. So yes, this has been bad. We are, knock on wood, that we haven't had any residents had COVID, and we would love to get through the rest of this without that happening.
Right.
And we may, vaccinations are coming soon. Within 3 weeks, we believe everybody here, according to the Marin County Public Health Department, will have been vaccinated. That means everybody who works and lives here will have been vaccinated within 3 weeks. That's great news. Back in March last year, when we thought it was going to be around for a couple of months, if you had told us it was going to be through the year,
I know.
I don't know what we would have done.
Yeah.
But now that we can actually see a light at the end of the tunnel where we can begin to get back to normal, now it's going to be several months. The vaccination is a cure-all.
I don't think there's going to be a normal. We're not going to go back to the normal that was before.
Hopefully by this time next year, it'll be a lot closer to it. We won't all be walking around with masks.
Of course. I mean, I'm looking beyond this pandemic. I think it's opened up a lot of people's minds and eyes on what is really going on in our country, in the world.
Yeah.
I mean, New Zealand and Sweden don't even have lockdowns.
Right. And
they don't have any deaths.
Right. Now, Norway took a different approach, and I don't think New Zealand does, I think it's very limited. I think Norway and Sweden have more, but the approaches have worked different ways in different areas. And so we'll see. We'll see what happens.
Yeah, there's so many, differences, and the whole thing is you can't judge it from just one country or whatever. It's but I think in the long run it'll basically, even though this has been kind of dividing people, I think in the ultimate end it'll bring people together. I
certainly hope so. That's the intent. That's the desire.
Yep.
That's our worldview, and certainly mine, and what the people that work here do. And it's what's so inspiring to me about coming in every day is that everybody else does. They know they're risking themselves and their family and their loved ones but they have come in every day to take care of other people. That kind of spirit of selfless, wanting to make the world a better place, wanting to
Yep.
take care of other people
Amen.
is just so inspiring. It's the thing we can't teach, but the thing we most look for when we're hiring somebody, because we can teach virtually everything else.
Oh,
And that's
absolutely.
that you can see it with the residents and the staff interactions and the team, the staff, the residents just did a holiday collection. We're not allowed to do tips or anything like that. Not allowed to provide gifts. So the Residents Association collects money and gives it out to the residents, the team members at the end of the
Yeah,
year.
sure.
They just did that yesterday, and they raised a lot more than they have in any other year because
Oh,
they appreciate the fact
of
that
course.
so many people have helped try to keep them safe.
Oh, yeah. And they have to take care of themselves first so they don't
Yes,
bring
yes.
it in. Yeah.
But
Well,
we couldn't do this without the board support. We couldn't do it without the public health department support and all of the team members that are here and the families and other caregivers that support the residents here, all working together to try and follow the guidance that we've been given to keep people safe. We understand there are only a couple of other communities, retirement communities, and there are a whole lot when you start adding up the board and cares, but only a couple other communities in Marin who haven't had a resident with COVID. We're very proud of that. We
sure.
worked really hard on that, but we've also balanced it with having a lot going on so that people aren't as depressed or lonely.
Right. All of it. I mean,
Yeah.
and kudos and gratefulness to you, Hunter, since you're the leader there, and obviously you've taken a wonderful lead on preventing the worst that can happen. So thank you for your support and your uplifting guidance and support for your community. Absolutely.
Thank you so much. And I tell everybody, I get more credit than I deserve, and I rarely get as much blame. It really takes everybody. I was honored with the Spirit of Marin Award this year. I've only been here about 3 years, so I didn't even know the depth and meaning of it. And I've learned since winning of it how much of an honor it is, and I appreciate it. But it really is reflective of the whole team, from the board to the residents to the team members to the families. I appreciate getting credit. I appreciate being able to talk and share, but
Absolutely.
it doesn't work by one person. It's not about me. It's about our
but still,
community. Yeah.
You know what? The organization, any organization is governed by the leader, and you set the pace. So you know what?
Well,
you've got some great people working with you.
Yes, yes, we do. We have really good people, and I'm standing on the shoulders of many great people that came before me too.
Oh, of
and
course.
hopefully I'll be able to leave it in such a way that whenever I do move on, that somebody else can do the same and continue this wonderful tradition we've had here. We just actually had our 48th anniversary on December 3rd.
Okay.
We're looking forward to our 50th 2 years from now.
Yes, that's going to be a big party.
Yeah, that means a lot of people came before me and put a lot of great things in place, though, too. So again, it takes a whole team to do a really good job, and to do it on an affordable way, in a really good way, in a quality way. And that's why I'm here. I love what I do, and I appreciate the opportunity to talk with you and share with others about what we can all do to keep safe.
Absolutely. And I will, in the credits on this, and this will also be a podcast.
Oh, wonderful.
Yeah. So it'll go out multiple social networks.
Well, and I'll try to put it out too. I do work in the community. I'm on the chamber. I'll be the vice president of the Mill Valley Chamber next year.
Okay.
And we'll try to spread it out too.
Yeah, well, I honor what you're doing, and I think you're doing a fabulous job, and thank you for coming on this show. Our time is short but sweet. And we've covered a lot of information, and you've shared a lot of your knowledge and what is going on in your Redwoods community.
Well, thank you, Dr. Cheryl. I wish you the best through this holiday season and into next
Oh
year.
yeah.
And everybody else, I wish for happiness, safety, and good health.
And keep your sense of humor and
Absolutely.
be joyful. I say happy, joy. That's
And I read a quote the other day. If you're looking to get more cheer and joy in your life, try and share cheer and joy with someone else. And
oh, that's the key. Anyway, until the next time.
Wonderful. Thank you.
Thanks.
We hope you enjoyed today's episode. We encourage you to apply the information you've learned with our wise guest to make your life better and make good changes. We appreciate you more than you know for being a part of our podcast. When you are moved or motivated, please let us know how the show influenced your life. Until next time, feel healthy and happy in your wealth, no matter where you are in your life.